Hi everyone, I'm Dr. Ankur Ahuja. I'm an interventional cardiologist working at Fortis Hospital, Mohali. There are alternative tests for coronary angiography. There are two kinds of tests where we are looking to establish structural disease, that is by anatomy, or where we are looking to establish functional implications of a blockage in the heart. That is we call as physiological test. So anatomical test, most common alternative to coronary angiography is by means of CT coronary angiography. What is CT angiography? Here we use CT machine to detect the blockages in the heart. We don't use wrist or groin route. Here we use a simple IV cannula which is put into the vein, dye is injected, and then CT images are captured to detect any blockages. The pros and cons for CT angiography is it's a very easy tool, it's a non-invasive, doesn't involve putting in local anesthesia, something like that. But the cons to it is it's not as accurate as coronary angiography, and again it involves use of contrast and X-rays. The major advantage for CT angiography being non-invasive test, it doesn't require admission, the complications are less, but the information we achieve is little less accurate. There are physiological tests, as we call as functional tests, which can be done to diagnose coronary artery disease. The simplest of these is treadmill test, which we all are aware. Here a person walks or runs on a treadmill and subsequent ECGs are recorded to assess physiological influence or a functional influence of any blockage by change in ECG pattern. Although it's very simple, it's the most inaccurate of these tests. Second test which we can do is a stress echo. Here again a person exercises either on a treadmill or a simulation of exercise is given by a medication, and when the heart is functioning on a stressful situation, echocardiography is recorded to detect any abnormalities in the function of the heart, and subsequently implications of coronary artery disease can be diagnosed. And the most sensitive, most accurate of these physiological tests is stress nucleus study, where a radionuclear substance is injected into the body under periods of stress, and the images are captured to detect the consequences of any coronary artery disease by interpretation of these images. The disadvantage for this test is because a radionuclear substance, it involves some radiation use.